Welcome. If you're new to the show, what we do is I do two 24-minute segments when I do this show. Whatever platform you're on, if you have any health questions, type in your health question. At the 24-minute break, my producers, Garrett and John, will read me the questions that you wrote. I won't know who you are, so it's okay. I'll answer your questions, and we'll do another 24-minute segment, then we'll answer more questions. So it's a great opportunity to get your health questions answered. Any topic. Today we're talking about thyroid. But any topic you have, if you're listening live, please put in hashtag live. It's now 1 o'clock on February 12th, 2024. Just put in hashtag live and where you're from. If you're listening on a replay, put in hashtag replay. And if you don't mind, tell me where you're from. If not, that's fine too. It's fun for me. And that's how it works. So it's pretty simple. So what we're going to do, we're going to start in just a second. And there you go. Okay. So got to put that disclaimer in there. And again, any questions, a great opportunity. Do me a favor right now. Share this with your entire list of everybody on your contacts, because this is so important. Every show we do is important. Today, thyroid, of course, is really important as well. And if you would this week, you have one homework assignment. I'll give you all this information as my gift to you. Tell one person about our show. Have them follow me at Dr. Joe Esposito. And whatever platform you're on, follow me on all the platforms, Facebook, Instagram, YouTube, TikTok, at Dr. Joe Esposito. That's just what I'm asking for you as payment for the show today. If you don't do it, nothing I can do about it. It's just good karma. I'm big on good karma. All right, we ready to start, gentlemen? Okay, I'm going to clap to set the sound, and then we're going to get going here. Ready? Hey, folks, Dr. Joe Esposito here. I'm glad you're with us today. What we're talking about today is thyroid health, because so many people come to my office with thyroid problems that were diagnosed. Countless others, I'm guessing, have thyroid problems that they haven't had diagnosed. Because one of the problems is we can diagnose the thyroid with blood work, but there may be other things going on, what we call subclinical reactions. And so we do a test called a Dutch test, which is a urine test, and we can test not only your thyroid hormones, but are they being broken down properly? Are you passing them out properly? Are they being stored? It's really much more in-depth test. We do a Dutch test for thyroid as well. But that being said, a lot of people have thyroid. Now, the information I'm going to give you today is good for everybody. It's not just for people with thyroids. If you've listened to me before, you know I'm very proactive. I want to fix things, A, before they break, and B, I want to get to the cause of the problem, not just treat the symptoms. So let's start with food triggers. There's 3 foods mainly that can trigger the thyroid, but this goes for any autoimmune disease. Rheumatoid arthritis, Sjogren's, anything where the body is attacking itself, multiple sclerosis. So the 3 main food triggers that really mess with the immune system are going to be gluten, dairy, and corn. Now, not to say that other foods aren't problematic. Of course they are. But these are the 3 ones I really want you to consider eliminating. I would like everyone to eliminate them, because I'm going to talk about leaky gut in a second, how it can cause problems with the leaky gut. And these are the 3 foods that really are the most allergenic, the hyperallergenic foods. Gluten is the most common allergen, and dairy, of course, they're probably tie right up there. And so there's a few reasons for this. Gluten has become a real common allergen because proteins like wheat, barley, and rye contain this gluten. And gluten is broken down to 2 components, gliadin and glutenin. Don't worry about the big fancy words there. And we have a real tough time breaking them down in the human digestive system. And it's gotten worse as time goes on, which I'll explain in a second. So if we can't break it down properly, it can cause something called leaky gut in just about everybody. Now, when I went to school a couple hundred years ago, I remember Dr. Richard Lord teach me about something called leaky gut, and it was unknown. I'd never heard the word before. And medically, it was being poo-pooed. It's a bunch of malarkey. I was going to say something else. It doesn't really have an effect on the body. But what we're finding now is modern research has found out that this is a true thing. And in many places in your colon, it's only 1 cell thick. That's the lining of your colon. So if you do things that cause an inflammatory reaction like wheat, barley, rye, corn, dairy, it can cause an inflammatory reaction, and that gap between those cells can become loose and open up. When a gap opens up, you start to absorb big chunks of protein, fecal matter, bacteria, viruses into the blood system. Now the body says, what is this thing floating around in my blood system? I don't recognize it. It's a foreign protein. So now the body starts attacking these foreign proteins. And when the immune system starts attacking foreign proteins, sometimes if there's an issue, it starts attacking you, starts attacking your own body. So that's why you really got to cut these things back. Now, some people might get away with eating gluten. Some people say, well, I don't have a problem with it. That's a clinical problem. Subclinical can cause a problem. So what I suggest when it comes to thyroid, or pretty much everybody, let's cut out the wheat, the dairy, and the corn, let's say 30 days. Play my game. If I'm wrong, I'm wrong. So what? You didn't eat wheat, barley, and corn for a while. Dairy and corn. So let's see what happens. And at the end of 30 days, go back to eating it again and see what happens. And if you start noticing I'm gassy, I'm bloated, I'm tired, I have brain fog, I have fatigue, my breath stinks, diarrhea, constipation, then you realize that you're having a reaction. One of the issues we have when we talk about food sensitivity is that people don't know they have it. I had a secretary one time, her name was Nisla, and she had celiac disease, horrible celiac disease, had no idea she had it. And I remember her telling me the story, and it really had an impact on me. She said, I thought everybody had multiple bouts of diarrhea every day. I didn't know it was abnormal. She goes, I pull up to the fast food restaurant. They knew who I was. They'd have my order ready for me when they saw my car pull up. And it was always, a muffin with eggs and bacon, diet soda, coffee, the standard stuff, waffles, whatever it was, pancakes. And she couldn't do wheat and dairy. And she was eating wheat and dairy multiple times a day. And she was overweight. And she was sick all the time, and she just thought, well, everybody feels this way. It's just normal. When she was diagnosed, she realized I was doing it to myself. So what you might consider normal might not be normal by simply eliminating some of these foods. Again, dairy, some people have a direct sensitivity to dairy, but it's very possible that one or more of those dairy proteins can cross-react with the wheat. So if you have dairy by itself or wheat by itself, you put them together, it can even be worse. Now, some people might do okay with raw dairy. My main office is in Georgia. You can't buy raw dairy for human consumption, so that's not something we can do here. And there's also something called ghee, Ghee. And I learned about this years ago from a friend of mine who taught me meditation. And ghee is you take butter and you boil it for a long time, and you keep scraping off the foam on the top. And after a while, what's left is ghee. It's a purified or a clarified butter. And people think, well, that's okay, that's better. It still has the proteins in it, the proteins that we can't break down. And that's where the problem comes in. So I'm not asking you to give this up forever, although kind of backdoor I kind of am. But just give me a shot. If I'm wrong, I'm wrong. If I'm right, I'm right. What do you got to lose? You got nothing else to lose. Now, the other research has shown that proteins from corn can also cause celiac-like reactions and cause inflammation. So it's alternative pathogenic mechanism, it's called. But the bottom line, it still causes those problems. So in other words, eating corn may cause a reaction just like wheat. So I've had people that were told they're celiac, they can't eat wheat, and they eat corn instead, and they keep having reactions. And the doctors say, well, I'm not sure what's going on. Well, dairy, wheat, and corn. Okay, but let's not focus just on diet alone. Now, if you're just tuning in, I'm Dr. Joe Esposito. I'm talking today about a protocol for autoimmune conditions, specifically thyroid today, but this kind of floats across all autoimmune issues. Now, diet is really important, but there's also lifestyle changes. You can test positive. You can do your thyroid test, and you have all these positive tests coming back. But what we have to do is we have to address the autoimmunity. So what causes the autoimmunity? Why is my body attacking itself? Number one, genetic predisposition. You might just have a genetic predisposition to it. I know that because there's a family member of mine whose mother and grandmother have a thyroid issue. And when she was born, she was super cute. Big eyes, super active, cuddly, high energy. And I remember one day I was holding her as a baby, and I felt her heart, boom, 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 up against my chest, beating like crazy. And big, beautiful eyes. And I thought, wow, this kid's really cute, but something's wrong with her blood pressure, with her pulse. So I remember watching her nap one day, and her eyes didn't even close all the way. So didn't put it together right away, but then I thought, wait a minute, her mother had her thyroid removed. Her grandmother had her thyroid removed. She had Graves' disease. Let's run a test on her. And sure enough, she had genetic Graves' disease. And Graves' disease causes this hyperactivity. And the heart race is so fast that it could come out of rhythm, and she could actually die. So pretty serious condition here. So genetics have a big part in the whole thing. An environmental trigger, it could be chemicals in the air. It could be your food, of course. And the increasing what we call intestinal permeability, that leaky gut syndrome. And that's a problem. So as you know, you can't change your genes, but we can help the autoimmunity and remove the triggers and heal the gut. Now, let's assume you have Graves' disease and you had surgery, had your thyroid removed. So you're on medication for the rest of your life. Absolutely, you need it to survive, of course. But that doesn't mean you still don't have a genetic predisposition to other autoimmune problems. So one of the arguments I had with a patient one time, I had my thyroid removed, so what? Doesn't matter to me anymore. I don't have a thyroid. I said, yeah, but you still have the gut permeability issue that is possibly there, and your body's propensity to attack itself. So we got to look at that too. So we got to look at food, we got to look at stress, we got to look at chemicals, and we got to look at infections. If you have a yeast infection, if you have a tooth infection, all these things can trigger autoimmune issues. Specifically, we're talking today about the thyroid. So as you can see, one of the main categories we talked about is food. So food can trigger by itself. A certain food might be your sole trigger, we call it. And eliminating that food might help reverse the autoimmune component of it. So that's why I say let's cut out the wheat, the dairy, and the corn and see how you feel. And if it didn't work, well, it didn't work. Now, if you're going to eat wheat, dairy, and corn, I wish you wouldn't anyway, but if you do, I'm going to recommend organic only. Because I'm going to cover this a little later, but when I was a kid, wheat was not sprayed with something called glyphosate. Glyphosate is a weed killer. And what we do now is we spray it on wheat and oats very commonly because it kills it. It makes it easier to harvest. Well, the residual glyphosate is on the wheat and the oats, and then you're eating it. And what happens is glyphosate does a lot of different things, but one of the things it does, it can kill off the good bacteria in your colon, and the bad bacteria actually too. It acts almost like an antibiotic. And now if we don't have good bacteria, those cells in the colon can become weak because the bacteria helps protect the cells. And they can start to separate, causing that gap in between the cells, leading to leaky gut syndrome. And leaky gut is so prevalent in our society, and it's not really talked about. And so that's why you got to be careful with that. So as far as we know, if food is the only trigger, you just have to get rid of it. So if you avoid the foods, like we said, gluten, dairy, corn, your symptoms resolve, your thyroid panel, your antibodies normalize, then you know that food was the main culprit. It's not a genetic issue. It's not an environmental issue. If your symptoms don't improve, then most likely there's other triggers as well, aside from the food. Now, another thing with the thyroid has to have iodine to work. Now, if you ever do blood work on your thyroid, they're going to test something, thyroid-stimulating hormones, and they'll test the thyroid hormones. And the thyroid hormones are called T1, T2, T3, and T4. Mainly 3 and 4 are what we're looking at. What does the 3 and 4 mean? It's how many molecules of iodine are attached to make that hormone. So if you don't have iodine in your diet, the body has a real tough time making these hormones. Most people, their only source of iodine is iodized salt. Now, you've heard me talk about salt before. You're not supposed to use table salt. And table salt is the one that's iodized, the white salt. Now, you can use air-dried sea salt, Celtic salt. Those are good, but they still don't have high source of iodine. And the reason we iodize salt is many years ago, people in the Midwest, not near the ocean, were getting goiters. Their thyroids were getting really big because they didn't have enough iodine. So somebody smarter than me, I guess, came up with the idea, what's one food that everybody eats? Salt. So let's put iodine in the salt so that people don't get goiters. Well, it worked. But that doesn't mean your thyroid is working at its optimum level just because you don't have this big swollen thyroid called a goiter. So we want to get iodine. The best source of iodine is going to be sea vegetables, seaweed. Now, how many people eat seaweed every day? Not a lot of you. Seafood will have some in it too. I'm not a fan of seafood though. So sea vegetables, seaweed, kelp is really great source of iodine. So I created these two supplements. One is called Dr. Joe's Super Greens and one is called Dr. Joe's Essential Source. And when I created these supplements, one of the things I added to both of them is seaweed or sea vegetables. You'll never taste it, I promise you. It doesn't taste like fish. It's not very small amounts, but it's iodine that's so necessary for thyroid function. It's another reason why I say These are the minimum supplements most people should take. Now, they're on the website, drjoe.com, and they're 2 powders, and I mix a scoop of each, and I mix it with coconut milk, almond milk, I have a little jar. I shake it up. I add some vitamin D to it as well, because I take vitamin D every day. You should too. And I drink it every day. And I can't imagine starting my day without it. I always say it's the minimum supplements you should take every day. Prebiotics, probiotics, digestive enzymes, complete multivitamin, C vegetables, raw fruits and vegetables in a powder form, chlorella and spirulina to detoxify the liver, again, iodine, omega-3 fatty acids. I wanted to make the ultimate supplement, in my opinion, and that's what I did. So those are on the website, drjoe.com. I think you should try taking them. There is a disclaimer on there. If you're on blood thinners, just read the disclaimer. I explain what to do if you are. It's very simple. But other than that, most people do extremely well with Super Greens and Essential Source. So they're on the website, drjoe.com. You can order them right there. We usually ship the next day. So if you don't know anything about me, by the way, I'm board certified in chiropractic. I'm board certified in orthopedics. I'm board certified in pain management. I'm double board certified in nutrition. I have a BS in nutrition. I'm a retired dietitian, certified in traumatic brain injury. I've written 2 books on nutrition. I've been in practice 38, 39 years now. I've missed a half a day of work in all that time. Radio show host, television show host. I've been on Dr. Oz's show. He's been on my show. So we're very well known in getting to the cause of your healthcare problems. So if you have an issue, if you have neck pain, back pain, shoulder pain, digestive issues, nutritional concerns, make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We'd love to be your doctors. Let's get to the cause of your healthcare problem. There's no promises or guarantees that we can fix everybody, but we got a really high success rate. So go to my website, drjoe.com. If you're in the Atlanta area or you want to come visit us, you can make an appointment. Normally, the first visit is $940. I've reduced that for my listeners to $299. That's an exam, x-rays, consultation, first treatment, and going over the x-rays on your follow-up visit, and a complete nutrition evaluation. And then if you are a candidate for treatment, we talk about further care. If not, we don't. Whatever you decide to do is up to you. It's no high sell, no high pressure. I want to tell you why we think you're having those problems and what we can do about it. So if you're just tuning in, again, I'm Dr. Joe Esposito, website drjoe.com. We're talking today about thyroid issues. So we talked about eliminating foods like wheat and dairy and corn, and let's do it for 30 days and see if that helps. We talked about glyphosate, which is a weed killer, and it's so common, and it's used on so many different things. I mean, of course, it's used for, even in your backyard. If you have a lawn spray, a weed killer, it's probably glyphosate. Most of them are. But it can affect the thyroid and the immune system by killing off the bacteria in your colon. Not killing it totally off, but really destroying it. And so eating foods with glyphosate can cause an imbalance in what we call the microbiome. That's the bacteria in your colon. And that can set the stage for chronic health conditions, especially autoimmune diseases like Graves' and Hashimoto's, which we're talking about today, the thyroid. It's also important to mention that glyphosate can inhibit something called cytochrome P450. These are enzymes, and they play a big role in detoxification as well as the production of bile salts. Now, bile salts, it's bile, and it helps break down fats. And if you don't make proper bile salts, you may not be absorbing your fat properly and breaking it down properly. That can lead to a whole other issue, too. Now, if you have your gallbladder removed, you're not storing bile salts, obviously. There is a supplement I recommend. It's called Colacol. If you send me an email through the website, drjoe.com, send me an email, just say, supplement for gallbladder. I'll send you a link to the brand I recommend. And it replaces your bile salts, basically. And I tell people, if you don't have a gallbladder, I think if it was me, it'd be a law that everyone has to take these bile salt supplements every time you eat something fatty. Could be an avocado, could be nuts, could be a steak. Of course, I don't recommend you do that. Butter, cheese. You need to take it. And when I give it to people, most cases in a couple of days, they'll come back to me and they'll say, oh my gosh, my whole life has changed. I feel so much better. You need your gallbladder. You're not going to die if you have it removed, but it's really going to affect your health dramatically. So that's why I recommend that. But send me an email. That's not what this show's about. But the glyphosate can affect the body's ability to produce that. Glyphosate can cause mineral deficiencies, and studies show that it chelates or it binds to things like copper, zinc, iron, calcium, magnesium, and manganese. And so now you can't utilize them. And so it can lead to nutritional deficiencies as well. So you can just assume you have glyphosate in your body. Just assume there is. There's tests you can do, urine tests and stuff, but just assume you have it and then act accordingly. So you want to stay away from corn and wheat, corn, wheat, and dairy, because that's big sources of it. It's usually used on genetically modified foods. We genetically modify the food so that we can spray glyphosate on it so that we can kill the weeds but not kill the plant. Soybeans, another one. So if you're going to do any of those foods, wheat, dairy, corn, soy, I do recommend organic only, which won't have the glyphosate on it. Or better yet, just don't eat them. You don't necessarily have to see a problem with gluten to have a problem with the glyphosate. In fact, some people, if I take them off wheat, they do better. And then if I put them back on things like spelt, which is a form of wheat, very low gluten, organic, it's not the wheat that's causing the problem. It's the glyphosate causing the problem. So I've heard this story many, many times before. It's just a good idea to avoid it. It just is what it is. So it's not a good idea to put it in the body. Why would you want to put a toxin in your body? So you know now that a lot of commercial wheat and a lot of commercial oats have this problem. So try to avoid the wheat. Spelt is an option for wheat. Sprouted wheat is another option that breaks down some of the gluten. Sourdough can also help break down some of the gluten, but it's got to be organic. When I was a kid, the word organic didn't even exist. Now it does. In fact, you have to label the good stuff and not label the bad stuff. It should be the other way around, my opinion. So it's common to hear stories that people can go to Europe and eat wheat and not have a problem because they don't use glyphosate and they haven't hybridized the wheat. It's not genetically modified, it's hybridized. So again, don't worry about the semantics there. It's just really a good idea to avoid it at all costs because even if you're eating bread, it's still basically sugar. So if you're going to eat bread, sprouted organic bread, maybe. You could try that. Spelt, maybe. Those would be better choices. Gluten-free, but many times it's still eating a lot of sugar, basically. Another thing that you can do if you're worried about thyroid or any autoimmune condition is you got to manage your stress. Now, there's 3 types of stress in the body: chemical, mental, and physical stress. Chemical stress is your diet, your environment. That's what I'm trying to tell you to do. Go to my website, drjoe.com, and type in, "So what can I eat?" or "What can I eat?" And there I did a whole lecture on what you can eat. Okay, it's pretty simple. It's about 40 minutes. It's free. And that'll kind of give you the guidelines as to what to eat. Chemical stress, again, is the environment and food. Physical stress is usually back pain, neck pain, knee pain, foot pain. Folks, my team of doctors and I are really good at getting to the cause of the problem and not just treating the symptoms when it comes to pain. Not everybody, but we're really good at most people. So once again, make an appointment, drjoe.com. Let's try to get to the ultimate pain management is getting to the cause of the problem. And I am board certified in pain management. I'm the only chiropractor in the whole state board certified in pain management, actually, and non-surgical orthopedics and nutrition and chiropractic, of course. So when it comes to physical pain, we're really good at that. And then you have to look at emotional stress. Many times emotional stress is linked to your digestive system. If you're not absorbing nutrients like B vitamins, amino acids, you can't produce something called neurotransmitters in the brain. Neurotransmitters are the chemicals make your brain work. And so we always say if you're depressed, it's a serotonin issue. Well, there's 2 ways to approach it. Number 1 is utilize a little bit of serotonin that you're producing. Another approach, what if we just make more serotonin? And we do that in many cases by fixing the stomach. If you have acid reflux, heartburn, burping, gas, bloating, many times we can pull the stomach down away from the diaphragm, very simple, and increase your body's ability to break proteins into amino acids. Then we make sure you're getting enough B vitamins to methylate or convert those amino acids into neurotransmitters. And we see in many cases great results. So anxiety, depression, bipolar, ADD, ADHD, we talked about anxiety, all of that. I've never in my career of 38 years, or 39 years, found anybody who didn't have a digestive issue when they have emotional issues, ever. So getting the gut fixed helps tremendously in most cases. And then we may talk about supplements, Dr. Joe's Super Greens, Dr. Joe's Essential Source, digestive enzymes. I take digestive enzymes every time I eat a cooked meal. In fact, I made pea soup yesterday, split pea soup, one of my favorites, of course, all plant-based. And I take digestive enzymes when I eat that because I'm at my age, I don't have the enzymes to break those things down like I used to. Now, raw food has enzymes in it, so you could just eat raw food, of course, but I don't eat all raw food. And so I eat plant-based. I don't eat any animal products, but if I eat anything that's cooked, I'll take a digestive enzyme. It's really quick, it's really easy, it's really cheap, and I just don't know why everybody doesn't do it. So managing stress is real important if it comes to the thyroid, but any autoimmune disease, because if you're stressed out, it weakens the immune system, and then the immune system can't do its job. It has to stay focused. All right, folks, I got to go to break. If you have any questions, send them to me through my website, drjoe.com. We got a lot more to cover. drjoe.com. There's a little bot there. Just send me any questions you might have. Follow me on social media, please. I post health tips every single day. 1-minute tips, that's all, real quick. It's at Dr. Joe Esposito, at Dr. Joe Esposito. If you're a podcast junkie, go to your podcast service, type in Dr. Joe for the health of it. Dr. Joe for the health of it, and that's our podcast. And if you're a veteran, we're on your veteran referral boards list. So if the VA refers you to us, they usually pay for your treatment, and we love taking care of veterans. So, folks, I'm Dr. Joe Esposito. Again, the website, drjoe.com. We got so much more to cover, and I want to be your doctor. I want to help naturally get you well and keep you well. Tell your friends about the show. We'll be right back. That went quick. All right. Any preguntas?
There are a few. Does this advice apply to thyroid issues for the hyper and hypothyroid?
Yes. Mm-hmm. What else?
I missed the first gallbladder part. I had mine removed in 1996. What should I be taking?
All right. It's called Colacol. That's a brand name. If you would send me an email through the website, drjoe.com. Just send me an email, say gallbladder supplement, and I'll send you a link to the brand that I recommend. Okay? What else?
What can be done for kidney problems? My friend doesn't have diabetes, but does have kidney issues and suffers from gout.
When I first started in practice decades ago, almost 4 decades now ago, I never saw a kidney patient. Now I see 3 or 4 a week. We're chiropractors. We're pain management doctors. We're nutritionists. What are we doing seeing kidney patients? So many people have kidney problems now. So I believe, my opinion, it's due to so much protein that we're eating. We eat way too much protein. And animal protein literally just tears up the kidneys. Plant protein, same amount of protein, no problem at all. So my advice to kidney patients, got to give up all animal products, meat, butter, cheese, yogurt, eggs, ice cream. I recommend nitric oxide if they have normal or high blood pressure to open up the blood vessels. Supergreen's an essential source to alkalize the system. And there's also a supplement called Renafood. Send me an email. I'll send you the link to it. It's not one of my supplements. And that's really good. And I've had patients come in. I had one recently. What's her name? Connie. She came in a couple of months ago, and she was at, I want to say, 32% kidney function. And she basically sat on my table and said, I'm going to die. I have nothing. There's nothing I can do. I'm going to die. I'll do anything you say. So I did her exactly what I just told you. I got her on these supplements, and I don't know, maybe 6 months later or so, I get a phone call. It's an emergency call from Connie, and she was coming in as a patient regularly, but we have several doctors here, so she wasn't seeing me. And she said, I have to talk to Dr. Joe. And normally I don't take emergency calls because I'm busy in the middle of the day, but I did. And she said, my kidney function is, remember it was 32. She goes, my kidney function is now 52. Thank you. Goodbye. And she still comes in, and she's doing great, and she's no risk of dialysis anymore, and she's just thrilled to pieces. And her kidney doctor said what most doctors say, whatever you're doing, keep doing it. And I said, well, ask your doctor to refer me all his patients, and I'll do a workup on them, and let's see what we can do. But that never happened, unfortunately. But the doctor supported it. Do whatever you're doing, keep doing it. Obviously, kidney results don't lie. So if you go to my website, drjoe.com, just type the word kidney in the search bar, and you can listen to a show we did on kidney. So what else?
What is autophagy?
Autophagy, that's when your body starts eating itself in a good way. So autophagy is you have cells in your body, white blood cells, that will attack and eat weak cells, dead cells, clean up bacteria. It's kind of like the cleanup crew. And so if the way to stimulate autophagy is to fast. After about 12 hours a day, everybody should fast. But you start going into about 14, 16 hours of not eating, your body kicks into major autophagy, and it starts attacking and eating up bad cells to keep you alive. Now, you have autophagy going on all day, every day. That's just a little way to jumpstart it. So.
What is a ketogenic diet, and is it good?
Ketogenic diet is staying away from carbohydrates and eating proteins that convert into ketones. Your body uses glucose as its main fuel, but if you start eating more than about 30% of your body fat, it starts burning ketones instead, and that's a chemical process. I am not a fan in any way, shape, or form of ketogenic diets. Now, I am a fan of cutting back on processed carbohydrates, absolutely. But the studies coming out now on ketogenic diets are just heart disease, brain fog, digestive issues, not recommended long-term. And I talked about this when it first became popular. Don't do it. So I'm not a fan. So Don't do it. Eat a good plant-based diet. You're going to be way better off. So, what else?
That's all for the first segment.
All right, let's get ready for part 2. Let's see how much more I got to cover. So much to cover. All right, I'll skip this next part. Let me see here. Okay, good. Ready? Hey folks, Dr. Joe Esposito here. We're talking today about the thyroid gland. Everybody's got one. Well, some people had it removed. We all had one at some point. And the thyroid gland is so important. It controls metabolism. It controls energy levels. It does so many different things, part of the immune system. But many times the thyroid malfunctions because of what's called an autoimmune condition. Autoimmune means the body is attacking itself. And so we talked about certain foods that can trigger this, actually make it worse. And those were wheat, barley, rye, dairy products, and corn. So I did suggest earlier, why don't we give those up for 30 days and see how you feel? Everybody should do that anyway, regardless of whether you have a thyroid problem or not, because they do cause problems. We also said that the immune system can be affected by your gut. 80% of your immune system is in your digestive system. And so many places in your gut, the walls are only 1 cell thick. And if these cells become loose and separated, it creates a condition called leaky gut syndrome. And leaky gut syndrome is when viruses, germs, bacteria, fecal matter can be absorbed into the blood system because the wall is broken down. And then the immune system starts attacking it. The immune system says, I don't know what that foreign object is. I better attack it. And then the immune system goes into overdrive, and it starts attacking itself as well. And one of the places it can attack is the thyroid. Graves' disease, Hashimoto's disease, where the thyroid gets attacked, and then the thyroid can't function properly. The body's attacking itself. And we said earlier that it could be from a genetic issue, and certainly that's a big issue. It could be from environment, and it could be from leaky gut, triggering all this stuff. So you got to take care of the bacteria in your colon. It's called the microbiome. Now, it's composed of bacteria, viruses, microbes, all sorts of different funguses. A lot of things go on in there. And these microbes have such a huge effect on your physiology. In fact, I think it was Hippocrates who said, look to the spine for the cause of all disease, but he also said, look to the gut for the cause of your health issues, somewhere along those lines. So that's why from a chiropractic standpoint, we always look at the spine, because the spine controls everything. Nervous system controls everything, but we got to get the gut working as well. So if you eat the standard American diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, chances are you're causing an inflammatory reaction in the gut, which can lead to leaky gut syndrome. So it's a big issue. So a healthy human gut might have over 1,000 different species of bacteria. And it's so diverse down there compared to other parts of the body. But unfortunately, a lot of people have their gut microbiome disrupted by eating a poor diet. We talked about environmental toxins like glyphosate that can kill off bacteria, even chlorine. What do you put in your pool to kill off the bacteria? Chlorine. What do we put in our drinking water to kill off bacteria? Chlorine. What do you drink when you drink tap water? Chlorine. And fluoride, which is another very bad thing. So these factors can lead to an increase in intestinal permeability, I call it leaky gut, and a disrupted microbiome can be a major factor in all autoimmune diseases. Rheumatoid arthritis, Sjogren's, this, of course, we're talking about thyroid, but autoimmune diseases are extremely common. So one of the things that we can do is we can give you steroids to shut down your immune system, calm down that immune system. Well, that works. However, they can kill off the good bacteria in your colon and long-term can cause problems. That's why I'm not a big fan of taking steroids unless you absolutely positively have to. And the good doctors that I work with, and there's some bad doctors, there's bad everybody out there, will all say the same thing. We don't want to give somebody steroids because it can really destroy their colon. We don't want to give them antibiotics because it really destroy their colon. Now, you might need them. If you need them, take them. Absolutely take them. I would take them if I needed them. But my goal is I try to stay as healthy as I can so I don't have to run the risk of doing those things. And so far it's worked. Okay, I did a brain study last year or 2 years ago, I can't remember now, and my brain was half the biological age of what I am. And the guy looked at me and he looked at the study, he looked at me, looked at the study, he says, I've never seen this big a gap ever in anybody's brain. How is that possible? And I explained to him, I keep my colon healthy. I give myself the nutrients that it needs. I get chiropractic care to keep my nervous system working. If my stomach acts up, I might get my stomach adjusted. And he's like, whatever you're doing, just keep doing it. Well, if there was a better way to be healthy, folks, I would do it. If meatball sandwiches were healthier and milkshakes were healthier, I'd say eat meatball sandwiches and milkshakes every day. I don't have a dog in this fight. I want to get you the best advice that I know of to get you well and keep you well. This is the advice I follow. If there's something new that comes up that's going to prove me wrong, or maybe a better way of doing it, I'm absolutely going to jump on that bandwagon. But I've been studying neurophysiology and biochemistry and nutrition for 40 years now, and I just keep getting deeper and deeper into the understanding that what we're doing works. And the studies just keep coming out one after another, proving it. Now, there are studies sometimes that say something contrary to what I believe, but when I do the meta-analysis, when I look at everything, I'm pretty happy. And with studies, too, you got to look at who paid for them. That's always a big issue, too. It depends what the outcome is going to be. So speaking of leaky gut, now there's evidence that all autoimmune conditions can be related back to this disruption in the gut. So in other words, you got to fix the autoimmune condition. You got to fix the gut if you're ever going to see progress in any autoimmune condition. It's really important. But when you're not experiencing gut symptoms, you say, well, Dr. Joe, I'm fine. My bowels work fine. I don't have acid reflux, heartburn, burping, gas, bloating, diarrhea. I'm in good shape. But what you're not experiencing, what you have to understand, is that if someone lacks gastrointestinal symptoms, doesn't confirm that the digestive system is in good health. It's called a subclinical reaction. That's why every day in our office, we take blood pressure on our patients. Many of them come and say, well, Dr. Joe, I don't have any symptoms. How can I have high blood pressure? That's impossible. Well, let's take it again. We take it again. Sure enough, you have high blood pressure. And if you've listened to my shows before, you know I say with the nervous system, 90% of your nerves, don't feel pain. So you can have pinched nerves and not know it. You don't feel your blood pressure, your spleen, your kidneys, your thyroid, your prostate, your ovaries, your hair grow, your eyeballs see, all controlled by nerves. So I feel this is a shortcoming in healthcare is we don't talk about the nerves that don't feel pain. I had a patient the other day, nurse, and nurses make the best patients. And I'm explaining everything to her, and she says, I've been to chiropractors before, and I've listened to your shows, I follow you on social media, and you just seem to make more sense than anybody I've ever met. So I lay her down, I work on her, and I adjusted her, and she stood up, and I said, all right, let's check you out, come in tomorrow, we'll go over the x-rays. And she's standing at the front desk, and she looks at me, and she goes, it feels better. It feels better. Like she was so surprised that her back felt better. And I said, I'm glad, but you understand pain is only 10% of the problem. She goes, no, I've never had it explained to me like that before. I get it. And I love teaching nurses and doctors this because they know all the information. They've just never looked at it like that before. And that's okay. My job is to enlighten. And then whatever you do with that information is totally up to you. So how do we restore our gut health? Number one, remove the triggers. We said wheat, dairy, and corn being the big triggers. That's important. Replace certain factors that play a role in digestion. Things like digestive enzymes, bile salts, if you don't have a gallbladder, especially bile salts. Dietary fiber. Oh my gosh, folks. Fiber, we're talking about the ketogenic diet. Somebody asked that question before. You got to eat fiber. Your whole diet should consist of fiber. If the food doesn't have fiber in it, you probably shouldn't consider eating it, in my opinion. So fiber has something in it called prebiotics. Prebiotics are the food for the good bacteria in your colon called the probiotics. Okay? So I eat a lot of fiber. My bacteria in my colon eat it, and they make little babies, and they colonate my colon, and I'm happy. And then there's something called postbiotics. Postbiotics are what the bacteria spit out, basically. B vitamins could be a postbiotic. A lot of B vitamins are made from bacteria. And what bacteria don't utilize, they spit out, and then we utilize. And that's why you have to have good bacteria in your colon. And that's why fiber is so important. Now, taking like a wheat fiber, wheat bran, not a good idea. You want to get your fiber from your vegetables because there's so many other benefits to that. And I cannot stress enough that, in fact, I was listening to a friend of mine, brilliant man, and he was talking one day, and he said, somebody asked me the other day about what's the number one anti-aging supplement I can take. And he looked at him and he said, fiber. That's it. More fruits and vegetables. It's very simple. Nuts, beans, seeds. And if you haven't ever ventured down this road before, There are so many delicious foods in the plant world. And you can eat your boiled broccoli if you want to, and you can eat your potatoes if you want to, and your peas, and that's all great. But when you really start going down that rabbit hole and start realizing how many amazing foods there are out there, it's so much tastier eating this way than is other ways. Now, people have come to me and said, well, Dr. Joe, I tried tofu once and I didn't like it. Well, then don't eat it. Well, what do you mean? Well, don't eat it. If you don't like tofu, don't eat it. There's I guess, about 120,000 other foods you could eat, so don't eat tofu. Okay, well, I don't know what to say now. My argument's shot, So it's so great. So taking a probiotic supplement is important. I take a probiotic supplement every day. And also in Dr. Joe's Essential Source, my favorite supplement, we also add prebiotics and probiotics to feed the bacteria and the good bacteria as well. One of the we have 72 different ingredients in Dr. Joe's Essential Source. I don't know why the whole world just doesn't take it. Again, if I become Grand Poobah of the universe, I'm going to lay down some rules. One of the rules is all houses have to have water filters and to filter out things like fluorine and chlorine and other junk that's in the water. Everybody should take Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders, and I mix them together. Now, the Super Greens, there's 3 flavors. There's mint, which is the sweetest one. There's hemp, which is a very nice flavor. And then the plain, kind of more earthy. So if you're not used to earthy foods, you might want to consider the mint or the hemp. The nutritional value is the same across the board. But the regular is by far our most popular product, most popular Super Greens. But if you have an issue with the flavor, you could add a little stevia to it. Just mix it with the Essential Source. I use coconut milk, almond milk, shake it up and drink it. There's no words I can give you to tell you how amazing it is when you take this stuff, in my opinion. And it's on the website, drjoe.com. And the other thing we have to look at is, are you digesting your food properly? Do you have acid reflux, heartburn, burping, gas, bloating, diarrhea, constipation? Many, many, many times, most times, the stomach is actually spasmed and pushing up into the diaphragm. And there's a technique my doctors and I use where we gently massage or pull the stomach down away from the diaphragm. And suddenly, there's a song like that, isn't there, right? Suddenly, you start to digest your food again. So the problem many times is physical, not chemical. And so much of healthcare is physical issues, and for some reason we're locked into treating it chemically. If the tires on my car are out of alignment, changing the oil is good, but it doesn't fix your misaligned tires. Same thing with the spine. If you have misaligned vertebrae, you can eat probiotics and prebiotics and Super Greens and Essential Source and whatever else, your vitamin D, B vitamins, but you got to realign everything too. So I look at your body like a car. You got to tune it up and put good gas in it. That's when I see the best results with my patients. And I've been doing this for a long time now, almost 4 decades. So if it is a physical problem, pinched nerve, stomach up against the diaphragm, ileocecal valve is a valve in the colon that could spasm, we have adjustment techniques for that. And it's really kind of cool stuff. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking about thyroid issues, but really this kind of encompasses all autoimmune conditions. You got to look at infections, especially gut and these hidden infections. So if you have an infection, and one of the infections I see a lot is candida. A candida infection can get into your colon, and basically this yeast grows crazy in your colon and starts fighting for food with the good bacteria and the bad bacteria. And simply put, the yeast can get bored. And again, this is just a silly story to get my point across. And it'll burrow holes into the colon, get into those gaps into bacteria, and get into your blood system and become systemic. So if you have vaginal infections, if you have toenail fungus, athlete's foot, jock itch, if you have itching growing under the folds of your skin, thrush in your mouth, these are all signs you have what's called a systemic yeast infection. Now, you can take a drug for it, and it'll usually kill off the bacteria or the yeast pretty quickly, but the drug can have adverse effects on the liver. And once again, if you don't find out why you had this yeast overgrowth, it's probably just going to come back again anyway. So we have to start thinking about infections, which are putting a stress on the immune system, which can then lead to things like the immune system going crazy, simply put. So one dilemma we have is if you have to take antibiotics. Well, sometimes you do. Well, antibiotics can kill off the good bacteria, but they don't kill off the yeast. If you kill off the good bacteria, the yeast doesn't have competition, and it starts to overgrow and become systemic yeast. So here's a test I want you to do. It's absolutely free. Tonight when you go to bed, put a glass of clear water next to your bed. Tomorrow morning, scrape your tongue with your teeth, get a big mouthful of spit, and spit into the glass. You can wait up to an hour. And if you start to see little tentacles coming down, almost like a octopus, that's a sign you probably have a yeast infection. In fact, I've tested many people that have done that with something called, we have a micronutrient test we do here for many things. It tests for yeast. And 100% of the time, if they have that, they have the yeast infection on the test. So it just saves you a couple of bucks. And then you probably want to email me through my website, drjoe.com, and I'll send you the protocol we use killing the yeast. Because the yeast uses what's called a biofilm. It coats itself in this coating so your immune system can't see it. It's like stealth. And so we have to break down that biofilm. Digestive enzymes can help with that. There's other things we can do. Oregano. There's other things we can do to help break down that biofilm. And again, years ago, biofilm. That's science fiction, blah, blah, blah. Now, oh gosh, there is biofilms. They really do exist. So we try to keep you on the cutting edge of healthcare. We try to keep you ahead of everybody else. So with infections, it's really important. Same thing with teeth infections. Don't jerk around with your teeth. Get to a dentist. I don't treat teeth infections or tooth infections. You really need to take care of your teeth because the same lining, your gums, is the same lining that coats your heart as well. So if you have infections in your teeth, that infection can get into your heart. That's why if you have a heart condition and you ever need surgery or treatment, they always say go to the dentist first. Make sure you don't have any infections in there. So infections are a big deal. Some natural things you could try to keep on a regular basis: garlic, oregano oil, golden seal, cat's claw, caprylic acid, wormwood, black walnut, olive leaf, colloidal silver. These are all things that can help maintain infections. Now, they don't work as well as antibiotics, but they don't put a stress on your colon like antibiotics do either. So sometimes you need the medication, absolutely. If you do, you have to then consider, what can I do to rebuild my colon? So if you have to go to dentist, you have to get surgery, you have to take antibiotics, I get that. Then we need to rebuild the colon. Super Greens, Essential Source, Dr. Joe's Probiotics, a lot of fruits and vegetables for prebiotics, glutathione, they'll clean out the liver. That's what I recommend. And that's what I would do if I have these problems. So all the supplements we talk about, Super Green, Essential Source, vitamin D is so important for the immune system, glutathione, digestive enzymes, probiotics, they're all on the website, drjoe.com. You can just go to drjoe.com, click on the store link, and they're all there. We ship usually the same day or the next day. If you're in the Atlanta area, come by and pick them up. Save yourself some shipping costs. I'm perfectly fine not paying the post office. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. We can also do remote consultations, too. So if you just want to make an appointment just to meet with me remotely, we can do that as well. Now, if you want to make an appointment, if you have neck pain, back pain, shoulder pain, radiating pain, sciatica, if you're ever in a car accident, folks, if the car is damaged, you're damaged. Just remember that. If the car is damaged, you're damaged. Whether you have pain or not, come see us, and we'll decide if there's damage or not. drjoe.com. Normally, the first visit is $940. We've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, showing you what we found, and a complete nutrition evaluation. I don't know anybody who's doing that anywhere, much less at any cost. So $299, that's great. We accept all insurances. It depends if your insurance accepts us. Sometimes there's out-of-network benefits. Sometimes there's no coverage. Sometimes the insurance company is just a pain in the butt, and we don't want to deal with them because we lose money dealing with them. That's a real thing, by the way. So, and we have payment plans available. It's really easy to be a patient with us. So go to the website, drjoe.com. Stop suffering needlessly. So many of you are suffering needlessly, and when you come in, you say, why didn't I do this sooner? I don't know why I didn't do that sooner. Now, if you're in a car accident, you're going to get phone calls almost probably the day you got in the accident. People will scam your information off the police reports and call you and lie to you about doctors and lawyers. If anyone calls you, tries to set you up with a doctor or a lawyer, it's a scam. Don't do it. It's illegal, by the way. It's even a felony. So I don't know if you get involved, but it's a felony for the people doing it. So we're talking today about your thyroid and autoimmune conditions. So we talked about the biofilm. If you have this infection, it's really a challenge because most labs that test for infections don't test for the presence of biofilms. And as a result, when testing these infections, you're faced with a couple of different options. One option is to take the necessary treatment with what we call biofilm disruptors. There are supplements like digestive enzymes that might help. Glutathione is so important. I take glutathione every single day. It's one of the supplements I take every day. I think you probably should too. But it's great. Enzymes, of course, can break down that biofilm and get at that bacteria, virus, whatever it is. You want to reduce your toxic load. And you do that by cleaning up the liver, eating healthy foods, drinking pure water, not drinking tap water, of course. Even household cleaners. Make sure you stay away from chemical household cleaners, perfumes, hairsprays, any unnatural scent, new car smell. All those things are affecting your body. It's affecting your hormones. It can affect your immune system. So if you're going to paint, make sure you use low VOC paint, volatile organic compounds. Most paints now are low VOC, so it's really not that big a deal, but years ago it was an issue. Get rid of all your aluminum pots and pans. If you have nonstick cookware and it's scratched, throw it away. Don't even donate it. Throw it away. Because those chemicals in nonstick can cause some real serious issues. Eating more fruits and vegetables. Eating things like broccoli, cucumbers, cruciferous vegetables like Brussels sprouts. They help to methylate and break down chemicals and then also rebuild them again. Methylation is converting something into something that's usable. Very simple. So B vitamins, in fact, about 40% of the people have a MTHFR genetic flaw, which means they can't methylate B vitamins. So I take Dr. Joe's B complex because it's already in a methylated form. And we've seen people with autism. We've seen people with emotional disorders, pain issues. We get them on a methylated B vitamin, and many times we see results. Well, I take a B vitamin. Is it methylated? I don't know. Ours is. So methylated vitamins are so important to take. If you don't have the gene issue, you can methylate. But you don't know that unless you take a $600 test to find out if you have it. So why spend the $600? Just take a methylated B complex. Pretty simple, isn't it? You want to make sure your bowels are moving every day. If they're not, you want to find out why. Is it a pinched nerve in my low back? The nerves in the low back might cause back pain and leg pain, but they also control the colon, sex organs, and bladder. You might have your stomach pushed up against your diaphragm. You might have a spasm, what's called the ileocecal valve. And the ileocecal valve can be an issue. You got to think about toxic mold. Things like peanuts. They grow underground. They probably have a mold on them. If you cook rice, if you cook it and put it in the refrigerator overnight, mold starts to grow. Now, if you do it one night and you eat it right away, probably not that big a deal. Never eat rice more than a day old, because chances are mold is growing on it too. So you got to look for molds, and you can check your house for molds. You can do tests for it. We had one of my doctors years ago, and she was sick all the time. So before she took the job, we tested the office for mold, and we had zero mold. So it was okay. But it is a big issue, and mold can be an issue. So if you have black mold growing in your shower, if you see it on the walls, you have black mold. Very serious condition. You don't want to expose yourself to that, because it really is something that it can get into your system, and it's really a challenge to get out. So if you smell mold, if it smells musty like your grandmother's basement, there's mold there. Doesn't mean there's not mold if you don't smell it, but there is if you smell it. You got to reduce what we call systemic inflammation. The foods we talked about earlier, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, wheat, these all cause inflammation in the body, and that can aggravate an autoimmune condition. So you really want to bring down the inflammation in the body, and you do that mainly by avoiding those foods. Now, you can take turmeric. It's on my website, drjoe.com. Turmeric's a great anti-inflammatory, but the key with inflammation is if you have joints out of place, put them back in place. That's chiropractic care. And from food, avoid the bad ones, and the inflammation usually goes down. And take action to find your triggers. Find out what's causing the problems. And we would love to be your doctors. If you'd like to come see us, go to my website, drjoe.com. Again, we're really good at pain patients, neck pain, back pain, headaches, numbness, tingling, sciatica. But we also work on the digestive system. We do nutrition evaluations with our patients. We can do a micronutrient test on you. We can do a Dutch test to test your hormones and see where we are. Not just the blood work, way deeper than that. And let's try to get to the cause of your problem, not just treat the symptoms. So to make an appointment, either virtually or in person, drjoe, drjoe.com. Follow me on social media at Dr. Joe Esposito. We post every single day. If you're a podcast junkie, it's Dr. Joe for the health of it. But really just go to the website with any questions. Send them to me, drjoe.com. Folks, I'm Dr. Joe Esposito. Thanks for tuning in. All right. I think we covered everything. What you got?
Is balsamic vinegar a healthy choice for a salad dressing?
It's okay choice. Apple cider vinegar is better. I don't like apple cider vinegar. I don't like tart. I like sweet. So balsamic is a better choice. Do organic and you should be fine. What else?
Why do ear infections often cause severe sore throats?
Because there's a thing called a eustachian tube between your ear and your throat. And if the infection gets in the ear, the infection travels right down the eustachian tube and right into the throat and sets up in your throat. So that's what chiropractic care comes in, to adjust the upper part of the neck, try to open up that eustachian tube, and many times that allows then your body's immune system to attack it. So, yeah. What else? Garrett's got a question, a thought.
Yeah, I was talking to somebody about the water bottles that use smell pods instead of taste pods. Did you see what I'm talking about?
No idea what you just said.
Okay, so there's this relatively newer, as in the last couple of years. It's a water bottle that's a pod system for flavoring. But instead of directly flavoring the water, it has a scent.
Oh, interesting.
So because a lot of your taste is scent.
Right. Okay.
But something that we were debating about was, how does that work for things that you never actually smell? And I figured your olfactory system is connected to your mouth itself. So that's where...
Yeah, the olfactory system, it's the shortest nerve, cranial nerve in the body. That's why when you smell things, it has a direct connection right into your brain. There's no synapses or anything. So that's when you smell things, it brings back memories instantly. I remember that smell, Grandma's house. I remember that smell, that first girl I ever dated. I remember that smell. So you have good memory because it's connected right to the brain. The problem I have with what you just explained is what's making the scent. Is it pure rosemary oil? That's probably fine. Is it a synthetic rosemary oil or whatever it is? Not a good idea. So I'm going to guess that it's probably an artificial scent. And the artificial scent is what's called an endocrine disruptor. It messes with your hormones, and it can affect the immune system. So I don't like it. And it's probably a plastic bottle, too. So.
The question about the ear just reminded me of that. So when you are eating something or chewing something, is the olfactory system picking up smells from within your mouth?
It can, yes.
Okay,
Yeah.
that was my question.
Yeah.
You know, like,
because when you have a stuffy nose, you don't taste anything. It doesn't affect your taste buds; it affects your sinuses. So yeah, taste is a lot to do with smell. Absolutely. So
nice.
Probably fake though. Fake smells, I guess. What else you got? That's it.
That's all.
You guys are awesome. All right, guys, please follow me on all social media platforms at Dr. Joe Esposito. That's your cover charge for being here today. If you don't do it, I don't know you didn't do it, but you might get bad karma then, you know. Other than that, follow me and send me any questions through the website, drjoe.com. Make your appointments, drjoe.com.